Can you tell me, you mentioned cycles, and tell us how long is a cycle, and tell us, is there a point where you stop the treatment?
That's a very important question. So a cycle in general is 28 days. Again, 5 to 7 days on of therapy, 21 to 23 days off of therapy, again, over 28 days. And we typically give at least 4 to 6 cycles at minimum. Really, 6 cycles would be considered the standard before we say if patients are responding or not responding. One of the most important items is that anybody who achieves a response should really be continued indefinitely. There have been studies done, as well as cases I've personally seen, where patients have been on therapy for several years and they say, hey, I'm doing great, can I see if I stop it? Unfortunately, when we stop these medications, the disease typically comes back very rapidly, often within several months. And unfortunately, we often cannot recapture the response, meaning we restart the same therapy and we never get back to the count that we had before. So it's really probably the most important item, let's say a patient's not going to transplant, is that they should continue on therapy indefinitely and really never come off as long as they have continued to have their response. I would say at times, let's say a patient's been on it for months or years, sometimes the blood counts can trend down a little bit, and we may need to space out therapy a little bit. So instead of doing every 4 weeks, we may sometimes space out to every 5 weeks or maybe every 6 weeks at the most. And that's okay, and really it's a personalized approach with your patient based on their tolerability.